Hello everyone, welcome back to your anatomy lecture. Today we're going to be taking a look at the pelvic floor, and this should be our last lecture of the summer. So let's go ahead and get started by taking a look at the PowerPoint, where we'll see the pelvic floor has a bunch of muscles at the bottom, and these are muscles that will help with supporting both the anal structures as well as the urogenital structures as well. Just to review regarding the pelvis, though, you can see that it's formed by the two coxal bones, the sacrum in the back, and then also the tailbone, which is the coccyx. So this is for the most part, which is going to be at the bottom of the abdomen, but then it's also going to be inside of this region, holding your bladder, the reproductive structures, which depending on whether it's a male or female body will be slightly different, but the uterus will be in here, the prostate, and then you'll also have the urethra, and then also muscles here as well. So just to take a look at like the openings here, you have two openings basically. The greater or false opening, which is the region along the iliac crest, and then you have the true opening or the lesser opening, which is down here, which is actually going to be what can be held as well as pass through the pelvis at this point. So we're going to talk about a region called the perineum, which is going to be near the bottom of this region, but then also the urogenital diaphragm. So the true pelvis, you can see right in here, this is going to be formed by the sacrum as well as the ilium, and then also the top of the pubis as well. So this is going to be where you have the pelvic inlet, where everything kind of goes in through the pelvis, I guess. And then going out through the pelvis, you have the bottom region, which is called the pelvic outlet, formed by the pubic symphysis, the ischial tuberosities, the ischial rami, ischial and pubic rami, and then also the coccyx. So this is going to be holding basically everything inside of the pelvis, which is what we consider the true pelvis, basically. So regarding the pelvis, you may have heard that there are some differences between male and female structures, and this is the case, but it's not that they're different, it's just that they're slightly varied. And like the main thing here is that the female structures will be slightly wider compared to the male structures. And this does make a bit of sense because I'm sure you're familiar. The female structures are where the uterus, as well as the structures for developing an embryo, as well as passing a baby through, will be like located. So if you look closely, everything can be slightly wider, as in if you look at the pelvic inlet, it'll be more rounder and circular. If you look at the iliac crests and the anterior superior iliac spine, they will be wider and more broad. If you look at the ischial tuberosities, the same thing, wider and more broad. But then a couple more things that doesn't come up quite as much. So one thing that's actually really helpful to look for is the subpubic angle. So here's your pubic bones. This right here is your subpubic angle. If this is 90 degrees or more, then you can probably determine that this is a male body. But if it's less than 90 degrees, then you can probably determine that this is a male body. So all of the rest of them are pretty relative. Like without looking at another pelvis, it's kind of hard to tell. But this one, you actually do have a kind of more concise and concrete thing that you can compare between the two, because a 90-degree angle is something that most of us will have somewhat readily, whether it's the corner of a page or even like the corner of your cell phone or something. If you compare this angle to the corner of a page, like just putting this up to the bottom of the pelvis, if it's bigger than this, it's a female pelvis. If it's smaller than this, then it's a male pelvis. And then something else, I guess, that I would like to just bring up, although not on here, the coccyx is also going to be slightly differently oriented, as in the coccyx of the male body will be slightly curved under, while it'll be a little more straight for the female pelvis. Now that brings us to the pelvic floor. And if you look closely, there are some pretty broad muscles down here, which will collectively make the pelvic floor, which will both include the perineum, which is going to be mostly the posterior side, but it does extend anteriorly as well. And then you also have the urogenital diaphragm, which is all on the anterior side, basically. So in here, you can see the pelvic floor with two major openings at least. You have the urogenital opening, which is this one, which can be a little bit variable depending on whether this is male or female bodies. And then if you look closely here, you have the rectal opening or the anal opening. So these two openings will be for your digestive system or for your urinary and reproductive system, or two separately for your urinary and your reproductive system. So these structures will be at the bottom. They help to hold the pelvic and abdominal structures inwards, but then they can also help with supporting the diaphragm, the sphincter muscles down here, which will be your anal sphincters and your urethral sphincters. Now, taking a look at this, largely, these muscles make up a group called the levator ani muscles. So the levator ani muscles will be inside of here, and all of these broad muscles, for the most part, are the levator ani, except for one that you might remember over here. This is the piriformis. So the piriformis, and then technically over here on the sides, I guess you also have obturator internus, but most of these muscles throughout the bottom of the pelvic floor, that's the perineum. And the perineum will include the levator ani, which has puborectalis, pubococcygeus, iliococcygeus, and then coccygeus or ischiococcygis if you prefer. Now, a couple of connective tissues that you should look for as well. So you have the tendinous arch of the pelvic fascia, as well as the anococcygeal raphe or anococcygeal ligament. So those are going to be along either the midline or the edges. So the tendinous arch of the levator ani, here, let's see if we can make that a little bit easier to see. So the tendinous arch of the levator ani is this one right here, right along the pelvic floor against the obturator internus. And then you also have this part in the middle, which is going to be the anococcygeal raphe. And this is going to be where some of these levator ani muscles will connect to, which is connecting from the coccygeal to the anal region. So let's go ahead and take a look at our first muscle, which a lot of these luckily named for what they're around or attaching to. You have puborectalis. So puborectalis. So looking closely, you have the most the muscle most closely oriented to the midline. This is puborectalis, which is going to go from the pubis and then posteriorly and around the rectum. So you can see this right here. The puborectalis is going to be going around the rectum, but then just to be clear, you have the pubococcygeus, which will be next, continuing to the coccyx. So they're very close to each other, but slightly different. The puborectalis is the most medial, the most innermost one, and then you can just see it circling around right over here around the rectum. So in this case, well, for most and all of them actually, these are going to help with supporting the pelvic floor. These are going to help with reinforcing the external and internal anal sphincters. But this one in particular is especially helpful for, I guess, fecal continence. And so it's going to help with allowing you to hold in your poop. So this one can actually pull on the rectum a bit to help with closing it or keeping it closed so that you don't go poop when you don't want to. So you have other muscles that will help with doing that, but the puborectalis especially is directly surrounding this. So helping the external anal sphincter for the most part. This is going to be helping to hold in your boob. But then one more thing while we're here that I would like to point out, you may have heard that like leaning forward as well as lifting your thighs can help with like passing fecal matter as well. Like that's because of the angle of the rectum here. So if you were to be oriented a little bit more anteriorly, as in like if you were to bend over, that would make it easier, or you would have a straighter path of the rectum so that the fecal matter can pass a little bit more easily. So the puborectalis right over here, it will be going all the way to just surround the rectum. And then this is going to be innervated by the pudendal nerve, a nerve that once upon a time we did learn about, but also the anterior ramus of S4. Now, pubococcygeus is going to be from pubis to coccyx instead. So pubis all the way up here in the front, and then coccyx is going to be going technically to the anococcygeal raphe, which will be right back here, and then it's going to connect to the coccyx afterwards. So this will be going from pubis to coccyx now to the anococcygeal raphe, but like later on to the coccyx. But like the puborectalis, this is going to be surrounding the rectum to some extent, and when contracted can help with reinforcing the external anal sphincter as well as supporting the pelvis and the pelvic floor. But then also, same nerve actually, inferior rectal branch of pudendal nerve and anterior ramus of S4. And iliococcygeal, I mean, you can kind of think about this in the same way. Iliococcygeal. So the only thing that's a little bit different is that this is now oriented a little bit differently. Puborectalis and pubococcygeus, those were very straight, just going right down or right back around the rectum or to the anococcygeal raphe. But now iliococcygeus is a little bit more diagonal, but still the same thing. But in this case, from the tendinous arch, which is that arch right along the obturator internus, and then it's going to go inwards to the coccyx at the anococcygeal raphe. So anococcygeal raphe as well as the coccyx, but then it's coming from the tendinous arch, which is right along the obturator internus, which is right along like the ilium. So iliococcygeus, this is going to be broader, but it's also going to be doing basically the same thing. So it helps supports the pelvic floor, helps to maintain the anal rectangle angle, and reinforces the external anal sphincter, which is right at the bottom of the rectum. And then same nerves, in fact, inferior rectal branch of pudendal nerve, and then anterior ramus of S4. Now, coccygeus is the one that's slightly different from the others. The other three are kind of all together. Like these are actually what's forming what's called the levator ani, kind of like how we had a rectus spinae group. This is a group of muscles that helps to form the pelvic floor, but these are somewhat together in this case. But then coccygeus, although still kind of part of the pelvic floor, this is just slightly separate, which you can see at least a little bit of a gap here. And coccygeus, as its name suggests, is going to like the coccyx. So it is actually coming from the ischial spine and then going to the coccygeus. And you can see that it's slightly more lateral, which you can see right here as well. And it has a little bit of a gap between the rest of the levator ani and itself. So the coccygeus, it does also help with supporting the pelvic floor. It could also have more effects on the coccyx in this case, which is flex the coccyx. But then you also have the nerve, which is a little bit different, no longer innervated by the pudendal nerve, but still anterior rami, but of S3 and S4. So you can see that you have the pelvic floor down here, mostly formed by those big, broad muscles. which you can even see isn't very, I don't know, easily separable at like many times, because if you look closely, this is going to be puborectalis with pubococcygeus right around it, and then that's where you then start to get iliococcygeus and then coccygeus. So one more thing I forgot to mention regarding coccygeus is that some people will call it ischiococcygeus, which is like a good indicator of where it's coming from. Ischial spine to coccyx, but coccygeus is perfectly okay as well. So that was the pelvic floor, and you can see that it's slightly different between male and female bodies, just because there's one more thing for the female body, which is in this case, the long tubular part of the vagina. So if you look closely, it's still kind of surrounding the same thing. So like it goes mostly from or around the rectum. We have some other structures that'll be over here in what's called the urogenital diaphragm. So what we're looking at here is the perineum, and the perineum is going to be formed by the anal triangle and then the urogenital triangle. And just to kind of differentiate, when we talk about the perineum, like this is a little bit more specific. Technically, there are descriptions of the perineum, which is a lot more simple. Like the perineum can actually just be considered the part between either the scrotum and the anus or the vagina and the anus, right along the bottom of the pelvic floor. But we will be looking at the perineum kind of like in all of its structures, which will be basically your two diaphragms, urogenital, and then also the anal triangle. So you can see that basically divided up across from ischial tuberosity to ischial tuberosity. This is where you'll have one that's more anterior, urogenital, which has the urinary structures and the genital structures, and then anal triangle, which was mostly composed of your levator ani muscles. All right. So to take a look at the urogenital diaphragm and the deep perineal pouch, I mean, you can see the triangle here from ischial tuberosity to ischial tuberosity, but in the middle here, this is where it's going to then be connected to something called the perineal body. So the perineal body is where various muscles are going to be connected to. It's basically just like a tough piece of like connective tissue because we don't really have a bone in the middle right there. But that is going to be where different muscles will be able to attach to and anchor themselves to, basically. So perineal body is right here in the middle, but then it goes anteriorly along the bottom of the ischium and pubis towards the pubic symphysis. But then inside of here, this is where we have the urogenital triangle, which to divide up has a deep and superficial space. So the deep perineal space is going to be slightly deeper, as its name suggests. And if you look closely, there's this structure right here called the perineal membrane. So the perineal membrane is what's going to kind of divide up the superficial and deep structures. And although kind of hard to tell, there will be structures deep to this perineal membrane. So the deep structures, for the most part, are going to be containing structures for helping the urinary part, basically. So you have the external urethral sphincter, the deep transverse perineal muscle, the compressor urethrae, as well as the urethrovaginalis. So these structures that are a little bit deeper are going to be more responsible for helping with the urinary part of this system. So looking closely, we have our first muscle here, which is called the external urethral sphincter, which for the female body, you can see is a little bit different, but it's going to include a few different parts. But at the very least, here is the urethra right here. And then surrounding the urethra, at least primarily for male and female bodies, this is what you usually see. you have a muscle that's surrounding the urethra, and this is going to be able to contract or relax to help with holding in your pee in this case. So the external urethral sphincter will be voluntarily controlled. This is something that you can relax and contract yourself, which makes it so that you can hold your pee until you find a bathroom. But just to also be clear, you have an internal urethral sphincter, which is not going to be voluntarily controlled. This one will relax when your bladder becomes too stretched out or expanded. And when this one relaxes, that's when you really feel you better go pee soon. You need to hold it using the external urethral sphincter because your internal urethral sphincter has already opened up. So this is a muscle that's basically always contracted unless you're peeing. So hopefully that is the case. But you can see that it basically encircles the urethra. And when it contracts, it can compress the urethra so that it closes it unless you're ready to pee. And once again, you have the pudendal nerve, which is going to be segmentally innervated by S2 and S4, or S2 to S4. Now, if you look closely, for the female body, you'll have some more muscles here. So we'll talk about those in just a minute. But something that everyone has is this broad muscle called the deep transverse perineal muscle. So looking at those muscle fibers, you can see that they go across. This broad muscle is called the deep transverse perineal muscle. This is going to be basically holding the structures along the bottom of the urinary bladder. So this will be slightly superficial to your levator ani muscles. So like the levator ani muscles will be lower down. This will be it'll be deeper, not superficial. It'll be deeper to the levator ani muscles. It'll be more inward, a little bit higher up along the pelvic floor. But you can see that it's not surrounding the rectum, it's surrounding the urinary structures. So this is where you have your urogenital hiatus, which is where you could potentially, for female bodies in this case, have the urethra and the vagina, or just the urethra for the male body. But the deep transverse perineal muscle is kind of like a levator ani, where it helps to support the pelvic floor, but specifically in this case, like along the bottom of the urinary bladder. So this will be helping to support the urinary bladder as well as the prostate for men. But once again, the nerve is going to be perineal branch of pudendal nerve, S2 to S4. Now, a couple of muscles that you'll see for the female body, not found in the male body, you have the urethrovaginalis, and then also the compressor urethrae muscles as well. So urethrovaginalis kind of makes sense why only female bodies will have it, because it is going to be surrounding both the urethra as well as the vagina. So you can see that muscle right over here is kind of encircling both of the muscles, which we were able to see before, like this. So urethrovaginalis is surrounding both the urethra and the vagina. So this is a muscle that actually can, affect the vagina as well. So this will be helping to compress both urethra and vagina, and it is going to be innervated by the pudendal nerve as well, S2 to S4. But then the compressor urethrae muscle is going to be just running along like the front of the urethra. And to go back, once again, sorry, I'm flipping over like back and forth a lot, but this right here will be the compressor urethrae muscle, which is going to be right along like the front of the urethra, which is going to once again help with supporting the external urethral sphincter by being able to contract and close the urethra or compress the urethra. So you have a couple of muscles here. This one that's right along the vagina and the urethra will be the urethrovaginalis, and then the compressor urethrae will be a little bit more lateral, and it goes right along the sides and then just along the front of the urethra. Now that brings us to the superficial perineal space, which is going to be, as its name suggests, a little bit more outward, a little bit more superficial. But instead of being mostly regarding like the urinary structures, this will be a little bit more regarding the reproductive structures. So these structures will help with erections as well as kind of positioning structures, I suppose, a little bit. But these will be muscles including the bulbospongiosus, ischiocavernosus, and then we had a deep transverse perineal muscle. So we also have a superficial transverse perineal muscle. And keep in mind that you have that perineal membrane, which is going to be, in this case, superficial to it or outside of it. So the other structures were deep to that. These will be the superficial ones, more on the inside. Now, bulbospongiosis. Now, we haven't talked about this like in this lecture, but we will be talking about it later, which will be regarding the corpus spongiosis, and then later on, corpus cavernosus as well. The corpus spongiosus is going to be surrounding and supporting the spongy tissue of both the male and female reproductive systems, which is going to be part of the erectile tissue of either the penis or the clitoris. So bulbospongiosis, this is connecting or surrounding the corpus spongiosus in this case, and for either structure. So if you look closely, for the male body, it's going to be around the bottom of the penis, which is where you're going to have the corpus spongiosus. So this is going to be connecting from the perineal body towards the base of the penis, or along the base of the penis, which is going to be where you have corpus spongiosus on the bottom of the penis. So this, in this case, is going to help with allowing it to assist in erection by moving blood into the penis towards the glands. So when you squeeze this part, it kind of pushes the blood forward a little bit further down into the penis. But then you furthermore have the bulbospongiosis for the female body, which you can see over here. And then, although not shown, like women and the female body also have erectile tissues. So there's a little bit of this, which is going to be present in the, or a little bit of this, which is shown here at this small structure near the anterior aspect of the urogenital structures. This is the clitoris. So the clitoris is right here near the pubic symphysis, kind of like right at the front of all of the urogenital structures. And although we'll talk about it, or we talked about this in the reproductive part, but it's near the anterior junction of the labia minora. So the clitoris is a good thing to be able to find, and it's pretty simply located here. But if you look closely, you have these two muscles running along the sides. These are the bulbospongiosis. It's of the more medial muscles, which is going to be around the urogenital structures, but then also going towards the clitoris. But once again, this is helping with moving blood towards the more, well, towards the glands of the clitoris in this case, which is the part that's visible. And although not shown, the clitoris does have these parts that go along the sides of the urogenital structures, and basically they engorge with blood, and you can push that blood towards the clitoris. Now, ischiocavernosus is regarding a different region of the erectile tissues of both clitoris and penis again. Those are structures that will be much more related to, well, the corpus cavernosum in that case. So the corpus cavernosum will be on the top of the penis, and then it'll also be along like the sides of the clitoris as well. And if you look closely, from ischium to the top of the penis, this is ischiocavernosus. So this is going to once again be able to squeeze blood into, in this case, the corpus cavernosum of either structure. Now, something to, I don't know, also be aware of, from what I understand, this muscle can actually also elevate the penis a little bit, which can help with positioning and control, I guess, a little bit, but doesn't like change it too much, but it can elevate the penis at least a little bit. So we had that deep transverse perineal muscle, which is that broad muscle. And then just along the sides, you have these two skinny muscles, which will be the superficial transverse perineal muscle. And these are just helping to hold the perineal body in place and help with stabilizing it because there's a lot of structures that'll be connected to it. So this is just holding it by on its two sides to keep it, supported in the middle. So you can see it going from the ischiotuberosities over to the perineal body, which is where its action is going to be to stabilize the perineal body in the middle. And as usual, I think I've been kind of brushing over it, but perineal branch of pudendal nerve for basically all of them. Now that lastly brings us to the anal triangle, which is where you have the posterior triangle of the perineum, which is largely where you can see the levator ani muscles, but then you can also see your anal opening, which will have some muscles as well. So if you look closely, usually it's covered by quite a bit of fatty tissue, and this is going to also be where you see the gluteus maximus originating as well. So we talked about most of those muscles already. We talked about the levator ani muscles surrounding the rectum, but you also have, in this case, the external anal sphincter, which is once again a circular muscle, which is always contracting unless you are actively trying to open and release fecal matter. So the external anal sphincter you can see right here, and then you can also see parts of the levator ani muscle connecting to it. So surrounding the rectum, this is levator ani, and then this is the external anal sphincter, which is directly surrounding the anus. So external anal sphincter, it surrounds the anal canal, and this is the muscle that you can actively and voluntarily control to hold in your fecal matter. And in the same way that you have for the urinary system, the internal anal sphincter is involuntarily controlled, which when the rectum becomes stretched, will start to dilate and relax, meaning that this is going to open up, but you want to be able to contract your external anal sphincters to hold in all the poop. So yeah, you have the external anal sphincter, which is doing a lot of hard work, which is going to keep in fecal matter, which usually with the internal anal sphincter is not that bad, but when that starts to dilate, that's telling you should go find a bathroom because your external anal sphincter is going to be working hard in that case. But you do have a few parts to this technically, the deep part, superficial part, and then subcutaneous part, which is the part that's actually near the opening. So if you're going to see any part that's actually active of this system, you're probably looking at the subcutaneous part of the external anal sphincter. So you don't really see internal anal sphincter, or you do not see the deep or even the superficial part of the external anal sphincter either. Now, just a couple of structures that also go along with this. So looking at the pelvis, you can see that you have your sacral plexus, and then something that I'm sure we all tried to forget about here is the pudendal nerve, right here, coming near the bottom of the sacral plexus, which comes out underneath the piriformis, but then it also goes back in. So remember, the pudendal nerve comes out. It's going to be innervating all of your levator ani, as well as most of the urogenital diaphragm that we talked about, and it is going to be going out, but then it also goes back in. So you can see that right here, though, just this small branch, which is going to be going to your whole pelvic floor. All right, so yeah, a few more structures to talk about regarding besides muscles. Let's talk about some of the structures that you find inside of here, which, depending on which system, can include the rectum, the anal canal, bladder, urethra, and then a little bit different, like outside, you have some male structures, and then you also have internal male structures, which will be like various glands, and then the female body, all internal, ovaries, uterine tubes, uterus, and vagina. So we'll talk about this, or we talked about most of these reproductive structures in our lecture in class, but just a few more to add on to what we talked about today. So to start off with, looking inside of the pelvic cavity, this is where you'll have a couple of different spaces. So rectovesical pouch, and then for the male body, that is going to be this region back here where you find, or between the rectum and then the seminal vesicles. Recto-uterine pouch, which is going to be, once again, back here between the rectum and the uterus. And then vesico-uterine pouch is going to be right here between the uterus and then the urinary bladder. So this space is actually kind of like covered for the most part, and it's going to have the broad ligament that is going to be running along it. Now, inside of the pelvic floor, you have the rectum, which we've been talking about all day, but just to be clear, this is along the posterior side of the pelvic floor, which is where you can see the sigmoid colon connected, and then on the other side, the anal canal. So the rectum, I kind of talked about this, has a bit of an angle to it, which is that it's not completely vertical, but it actually has a little bit of a flexure, as in like a little bit of an angle, which it's not shown super well here, but you can see that the rectum has a bit of an angle as it's traveling towards the anal canal. So the anal rectal flexure is right here near the bottom, which I would like to find that other picture actually, just so you can see it a little bit better. So here, there is a little bit of an angle to the anus and the rectum, which if you were to kind of lean over and lift your thighs, it's going to help with allowing it to straighten out so you can poop more effectively. So going back down here though, the rectum is kind of like near the end of your digestive system, which is in the back of the pelvic floor. And depending on where, like whether it's a male or female body, either the uterus for the female body or the urinary bladder for the men, as well as seminal vesicles, will be right in front of it. So the anal canal, you can see right at the bottom here. This is basically the last part of the digestive system. This is where you have the internal and external anal sphincters surrounding it. But basically, this is just like a short inch or 2.5 to 3.5 centimeter long structure between the pelvic floor and then the outside of the body. And then regarding urinary structures, you also have the urinary bladder sitting inside of here, which is going to be anterior to the rectum. And I'm sure you're familiar. The urinary bladder is going to be able to hold urine until it's ready for it to be released. But notice that there are a couple of holes down here. These two holes are going to be for your ureters. So your ureters are going to have their openings near the bottom of the urinary bladder, actually. And then there's kind of like a triangular structure, which is not very it's not very easily discernible, but between the ureters and then also going down to the urethra, this right here is called the trigone. So the trigone is this region at the bottom and front of the urethra for the most part. And then you also have the body, which is the majority of it. But then you also have the urethral orifices, which will be, well, the one for the urethra, basically. And then you can also potentially see the internal urethral sphincter, which is right along like the base of the urinary bladder, extending into the urethra. So the external urethral sphincters are usually a little bit further down. The internal urethral sphincter, you can see right here. Now, I think our last structure is the urethra, which, depending on whether it's a male or female body, is slightly different in length, basically. So the urethra is shorter for the female body, while it's longer for the male body, which makes sense because for the male body, it has to travel from the urinary bladder and then down all the way along the penis. But just to be clear, when you look at the male urethra, there are actually like 3 parts to it, or rather 4, I guess. You have the pre-prostatic part, the prostatic urethra, the membranous urethra, which is surrounded by the urogenital diaphragm, and then the rest of it going down the length of the penis along the bottom, surrounded by corpus spongiosum, is the spongy urethra. So the spongy urethra does have another name, which is penile urethra, which is fine as well. But the urethra for the male body technically has 4 parts: pre-prostatic, prostatic, the membranous urethra in these, like, lined along the urogenital diaphragm, and then spongy or penile urethra. But then for the female body, it's basically just from the urinary bladder and then very short going down to the bottom of the pelvic floor. So something that I should just reiterate that is that there are 2 separate holes for the P and the repro for the female body, but for the male body, it's all one tube. So for the female body, the vagina and the urethra are separate. So this short urethra here is the urethra basically for the female body, which is completely separate from the vagina. So P does not come out of the vagina. You can see that it's a different tube. And then just to be clear, it's going, or like the tubes will be in order from like anterior to posterior, urethra, vagina, then anus. So this is kind of hard to see, especially on yourself, but it's there, I promise. It's just small. So yeah, I think that's all I need to say about that. But I'll give one last thing regarding the urethra, especially for the female body, is that this is not a very short distance. Like if there were any type of bacteria were to be kind of near the opening of this, it could somewhat easily get into the urinary bladder, which I'm sure you probably are aware is called a urinary tract infection, which can be along the urethra as well. But if it gets into the urinary bladder, that's when it starts to become more of an issue. So this is a pretty short path. So a couple things to just help with preventing that. Number 1, keep it clean. You can do that by wiping from front to back, away from your urinary and genital structures. So if you're wiping your butt, wipe from front to back, away from it, not front or back to front towards it. That's not good. But then also, I mean, if you were to be sexually active, make sure that you pee after sex, because stuff is happening with the rest of this like area, and that could lead to stuff potentially going up into the urinary bladder. So flushing out the urethra after sex is helpful to make sure that nothing goes into it, basically. But I think with that said, that's about it. So all done with the lectures. If you have any questions, please let me know. But thank you for listening. Good luck with your studying. And I'll see you all next time.